In Houston, Texas, hospitals are so crowded that a growing number of COVID patients are waiting in emergency rooms for hours and in some cases days before they can even move to a regular hospital bed. NBC News national investigative reporter Mike Hixenbaugh joins me now. And Mike, there are so many concerns here, but tell us more about those patients in Houston waiting so long just to get a regular hospital bed.
Yeah, that's right. What's happening here in Houston is that, it's the latest sign that hospitals are straining to keep up with the surge in demand for their hospital beds. And so when a patient comes to the ER for anything, typically they are, assessed, stabilized, and then moved to another part of the hospital where they receive specialized treatment, like an ICU or another ward where nurses and doctors have specialized training and background in treating their specific condition. And what's going on in Houston is there just isn't, those beds aren't open, and sometimes they're not open for several hours or days. So across Houston, hundreds of patients are receiving ICU level care or other type of care in the emergency room, in an ER bed. And what physicians told us is this is not optimal. This is suboptimal situation where they're having to bring the equipment and the staff to the patients in the ER rather than move the patient to the spot where they need to be. So the hospitals here are straining to keep up.
Yeah. I mean, this is a problem across Texas, right? I mean, the ICUs are seeing fewer beds each day. How are hospitals dealing with the increase in cases right now? What are they going to do if this doesn't get better?
So the hospitals have already started dialing back the number of what they call elective procedures or non-emergent surgeries that can wait. That way, those ICU beds can be set aside and open for COVID-19 patients. They're also opening sections of hospitals that have been closed or converting beds that have been used for other purposes and calling in nurses from out of state. But as the ER numbers show you, is you can't just flip a switch and have those beds be open. And so although the hospitals in Houston have been saying for weeks that we can surge, we can add hundreds of ICU beds, the reality on the ground is that's taking time. And in the meantime, it's creating this log jam of patients coming in the door. And that backs up into the city's ability to respond to EMS calls. It delays everything.
Mike, earlier this week, we talked about the growing number of people in Houston dying at home because of COVID-19. Are officials and first responders worried that even more people will be afraid to come to the hospital now because of this crowding, because they think they might not be able to get a bed?
They are. And candidly, their message is, look, we are busy. It's going to be different than your normal ER experience, probably. But if you are having chest pains, if you're feeling anything, if you're having a hard time breathing, if you're experiencing symptoms of a stroke, call 911, get to the ER, and they will stabilize you and they will take care of you there. And that way you're not waiting until it's too late. And so that's the message from the hospitals, that they are very concerned that people are going to see this message that the ERs are crowded, it's taking longer to get in. But frankly, the candid message from a hospital executive I spoke to at one of Houston's largest hospital systems was, look, we are going to keep caring for patients. We're going to keep expanding beds. We're going to keep doing everything we can, but there's a limit. And if things don't change, if these cases continue to grow as they have been for weeks, then we're going to be looking at another situation like New York was looking at in March and April, and the hospitals will run out of the ability to add capacity. They're adding capacity now, and it's slow and it's taking time, but at least they're making room for everybody. But there's a limit, and they're afraid that within a few weeks they might hit that.
Yeah, for those of us who are here in New York, we could tell you nobody wants to go in that direction. I think they know that. So let's hope things there start to improve. Mike, thanks so much for your reporting.
Thanks, Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.